Hi, my name is David Vilar. I'm a professor of pharmacology and toxicology at the University of Antioquia in Colombia, a former toxicologist of Iowa State University. I appreciate you coming on to watch this video. We're going to show how to make some basic calculations in acute toxic exposures and how to interpret them from a toxicological standpoint. And I would like to start by clarifying a few terms that are many times used incorrectly or interchangeably, whether that's correct or incorrect. Toxicology basically refers to the knowledge of poisons. Obviously, that's a very simplistic way of doing so when we look at all the aspects that surround a toxic exposure, starting by the identification of the poison, its chemical properties, the biological effects it's going to create on the animal, and the treatment of the disease condition that it's going to result from the exposure, which is what we usually know as the intoxication or toxicosis. When we talk about the toxicity of a chemical, we refer to the amount of that substance, whether it comes as a liquid, gas, or solid, that is necessary to produce toxic effects on the animal. And as you can see here, one way of expressing toxicity is in units of milligram per kilogram of body weight that the animals need to be exposed to become intoxicated. On this presentation, we're just going to deal with acute exposures, but as you can imagine, the duration of exposure can greatly affect toxicity of any chemical. So when an animal is being repeatedly exposed, the calculations to determine the amount necessary to cause toxic effects are going to be different between an acute and a chronic exposure. So when talking about acute toxicity, the term is usually reserved to mean the toxic effects of a single dose or maybe multiple doses in less than a 24-hour period. And that is regardless of whether the effects are going to become apparent in maybe a few minutes or several days or even weeks in the case of some chemicals, say methyl mercury or maybe some of the anticoagulant rodenticides. By contrast, when we talk about chronic toxicity, we refer to the effects produced from prolonged exposures being 3 or more months. And usually, to cover the gap between 1 and 90 days, the terms subacute and subchronic are thrown in. But we just won't expand to say any more on that here. Because we're going to use values of lethal doses to determine whether an animal has been exposed to a toxic level, we have to understand that any assessment in toxicology is built around the central principle of dose-response relationships. This concept was first described by Paracelsus 500 years ago, and it served him to be credited as the founder of toxicology. We have a human representation of him. Seems like he was bald-headed. People I've come across that are bald-headed are pretty smart. Whether that's true or not, I'm not sure. But some of his great contributions to science were attributed to some of the quotes like all things are poison and not without poison. Only the dose makes a thing not a poison. It's not the nature of a drug that determines toxicity, but rather the amount. And everything in excess is potentially toxic. Basically, all of these quotes are referring to the same thing, which is that the dose makes the poison. So having said this, let's now examine a common way to define the acute toxicity of chemicals that allows for easy comparisons between different compounds. On this slide, we have a table that shows the guidelines for classification of the relative toxicity based on the LD50, which is the lethal dose necessary to kill 50% of the animals in a population. LD50 has usually been the traditional endpoint that is used by many toxicologists and regulatory agencies to classify the acute toxicity of compounds. The table we see here is taken from one of the old times and classic reference books in veterinary toxicology. which is the third edition of Clinical and Diagnostic Veterinary Toxicology by Osweiler, Carson, and Buck. And as you can see here, any compound which is capable of killing an animal at dosages of 1 milligram per kilogram or less is considered extremely toxic. Between 1 and 50 is considered highly toxic. Between 50 and 500 would be of moderate toxicity, and at higher dosages are considered slightly or practically non-toxic. So if we look at some other sources, like this one by the World Health Organization, here we see the classification of pesticides based on the acute, oral, and dermal, which should really state topical toxicity to the rat. As you can see, any pesticide, whether it's an insecticide, herbicide, a rodenticide, fungicide, and so on, should be labeled with a symbol. In this table, they have mistakenly used the term hazard instead of toxic. Hazard usually refers to the likelihood that someone will be intoxicated if he's exposed to that chemical. In other words, a chemical may be very toxic, but if the chance of becoming in contact are low, we could maybe say that that hazard may be pretty much non-existent. For regulatory purposes, pesticides in category 1A and 1B usually have a signal word of danger or poison, and ideally you want that in red color against a distinct background. And sometimes you'll see the skull and the crossbones next to the word poison. If the pesticides fall in category 2, usually they have a warning, and if they fall under category 3, it's usually a word caution. And obviously, there is no symbol mandatory if they're non-toxic. Now, if we look at the toxicity rating by the EPA, which is used for regulatory purposes of labeling pesticides in the US, we see a very similar table than the ones we just saw. Anything with an oral LD50 below 50 milligrams per kilogram is deemed highly toxic and falls within category 1. As you can see on this table, they also include the exposure by other routes, such as dermal, which should really state topical, respiratory by inhalation, ocular, and capable of causing skin lesions. I should say that anything capable of causing skin burns on immediate contact should fall under category 1 and be labeled as dangerous, as we just saw. Having said this, let's now look at a hypothetical scenario on how to use the LD50s to interpret whether an acute exposure to a pesticide can result in an intoxication or not. Let's assume we have a dog that ingested one of several blocks of the rodenticide havoc, which contains brodifacoum at a concentration of 0.005%. So the first thing that we should do will always be to calculate the dose ingested on a milligram per kilogram basis. Obviously, we need to know how many blocks of the bait were ingested and the body weight of the animal. Let's assume we have a 10 kilogram dog that ingested just one block that weighs 50 grams. Knowing that only 0.005% of the bait is the active ingredient, the amount of brodifacoum ingested by this animal would be 2.5 milligrams. And when we divide by the weight of the animal, we come up with a dosage of 0.25 milligrams per kilogram. So once we have calculated the dosage, the next step should be to look for a reliable source of information on the toxicity of brodifacoum. On this table here, taken from a reliable reference, we have the LD50s for different animal species. I should point out that many times we don't have information for our domestic species, and we don't really have any alternative but to extrapolate from rats or mice, which are the two species most commonly used to assess toxicity. of chemicals. But in our case, we have data for dogs, and the LD50 reported is between 0.25 and 1 milligram per kilogram. So when we see a situation like this one, it's obvious that they have gathered data from different studies, and we really, unless we have some other source of information, we want to err on the side of caution. So we're going to use the lower value of the LD50, which in this case would be at 0.25 milligram per kilogram. Unfortunately, the LD50 is not telling us anything about the minimum lethal dose that would start killing the most susceptible dogs in the population. And again, we should always err on the side of caution and assume that our dog can be the most susceptible one. As a rule of thumb, a dosage which is 1/10 of the LD50 in most instances can be assumed to be outside of the toxic curve. So we would not have to worry if the dose ingested falls below that point. In this case, with brodifacoum, we know from years of many cases reported to animal poison control centers that exposures below 0.05 milligrams per kilogram pose no real danger. And so that's usually the cutoff point that is going to decide whether we have to raise a red flag or just simply disregard this as a non-toxic exposure. Now, the third step after doing these two calculations and assuming that the dose ingested falls anywhere within the lethal dose curve, the next step is going to find out how this rodenticide works and whether there is something that we can do to prevent this toxicosis from taking place. And in this case, we're going to be lucky because there is a very effective antidote that is going to protect 100% from the toxic effects of brodifacoum. So, assuming that we're past the point of decontaminating the animal because the ingestion took place several hours ago, we still have some room for acting. We know that the signs will not become visible for days or even more than a week with brodifacoum. This is an anticoagulant rodenticide that is going to inhibit vitamin K epoxide reductase in the liver. This enzyme is necessary to recycle the inactive form of vitamin K in the liver. And because this is really the only site of action where the anticoagulant works in the body, we could totally protect this animal by providing the active form of vitamin K. So in our hypothetical case, we could simply administer vitamin K orally for as long as the anticoagulant is going to remain in the liver. This is usually a 1 month therapy. And to be sure that all the brodifacoum has been eliminated from the body when we pull off the antidote, we could run some coagulation times, like protharmin time, for 3 or 4 days, just to make sure that the dogs don't need any additional therapy with vitamin K. As you may have already noticed, there are some caveats when interpreting the LD50, and that is it's not going to tell us anything about the shape of the dose response curve. On this graph, we can see that the value of the LD50 for strychnine and chlordane in the rat are the same. In other words, the dose that is going to kill 50% of the animals is going to be the same one for both substances. And yet, you can see that the slope is much steeper for strychnine, and that implies that more animals will die within a narrow dose range as opposed to chlordane, for which there is a much greater variation in response. And that's obviously going to make more difficult to predict the effects on any given animal, in this case for chlordane. In any case, and for a practical purpose, in any clinical setting, I have to say that probably the LD50 is the most reliable number regarding the probability of a lethal effect of any given toxicant. And that's what we usually, toxicologists, tend to use most of the time in acute exposures. Finally, to close this presentation, I would like to mention at least one website that can be consulted as a reliable site to look for information on the toxicological profiles of many chemicals, including most pesticides. It's called XToxNet. It's been put together by some of the biggest universities across the US. It's a very good source for anyone with access to internet. And to show an example, I look at difasinon, which is another anticoagulant rodenticide. And as you can see under the section on acute toxicity, they provide the LD50s for rats, dogs, cats, pigs, mice, and even rabbits. Having said this, I want to thank you for watching this presentation. I hope it provided some useful information, and I will look forward to have you on future ones where I'm going to address some specific intoxications that are common in our domestic animals. I want to thank you again. Take care and be well for now.